So histamine intolerance has gained a lot of attention these days, especially for the 51.6 million people who live in chronic pain every single day. People suffering from joint pain and fibromyalgia, rheumatoid arthritis, and connective tissue disorders often report exacerbated symptoms that mirror those seen in histamine intolerance. In today's video, I want to help you better understand and just shed some light on the relationship between histamine intolerance and many of these pain syndromes. And if you're new here, I'm Dr. Hagmeyer. I work with people all over the United States who struggle with just trying to find answers and trying to find solutions to histamine intolerance and MCAS. And I do this implementing natural strategies like functional medicine. Well, perhaps you stumbled on my health blog, or maybe you're watching this on my YouTube channel because you are trying to better understand more about, let's say, chronic pain or fibromyalgia, and you never really heard of histamine intolerance until just now. And that's completely okay. Now, if you're not familiar with histamine intolerance, I want you to know first and foremost that you're probably more familiar with histamine intolerance than you might think. While histamine causes the allergy symptoms, which you're already familiar with, like runny nose and watery eyes and itchy skin, histamine does so much more than that. Histamine is a naturally occurring compound in the body. It plays a crucial role in the immune response. It plays a role in digestion. It plays a role in heart rate. It influences our hormones, and it even regulates various functions within our body's nerve system. The problem with histamine really is that when the body's ability to break down histamine is compromised, histamine levels then begin to build up, they mount up, and that leads to a condition that we now call histamine intolerance. Now, if you're not familiar with histamine intolerance, the symptoms that we often associate are going to be things like headaches and digestive problems like diarrhea and bloating, skin problems, problems with blood pressure, depression and anxiety. And obviously, for the purpose of today's video, I'm going to be talking about histamine intolerance and various forms of chronic pain. Now, the link between elevated histamine levels and pain is not something new. This has been known for quite some time. You see, histamine triggers inflammation, and this, of course, can lead to overreaction of the body's immune system. And this, of course, results in increased sensitivity and increased pain throughout the body. And it's this inflammatory response that really explains why people with histamine intolerance and MCAS report widespread pain and discomfort throughout their entire body. Now, studies done at Stanford Medicine have shown that when mast cells release this histamine and other chemicals like tryptase, those chemicals begin to break down cartilage, they begin to break down muscles, and they break down ligaments, and they worsen conditions like arthritis by promoting inflammation and swelling in those joint and those tissues. For many of my patients who have struggled with chronic pain in one form or another, they have found tremendous improvement when we start reducing those histamine levels, when we start reducing this histamine load. So what if you have fibromyalgia? Can that be helped if you treat the histamine intolerance? And the answer is yes, it can. For those that don't know, fibromyalgia is a chronic pain syndrome. It's characterized by just widespread musculoskeletal pain, fatigue, brain fog, and of course, many areas throughout the muscles that become tender. And growing evidence here suggests that histamine intolerance also plays a role and contributes to the intensity and the frequency of fibromyalgia symptoms, including those flare-ups. You see, fibromyalgia patients often have mast cell activation, which again leads to increased release of histamine and increased release of tryptase levels throughout the body. And again, those elevated histamine levels result in widespread pain, heightened sensitivity in the muscles and in the connective tissues, both of which are those classic hallmark signs and symptoms that we see in patients who suffer with fibromyalgia. So here again, I've seen in many of my own patients who have fibromyalgia that improving the way the body breaks down histamine often leads to incredible relief, pain, fibromyalgia, but also many of the other symptoms like brain fog and depression and anxiety. Now, maybe you have a connective tissue disorder or you have rheumatoid arthritis and you're wondering, can treating histamine intolerance help my connective tissue disorder or my RA? And once again, the answer is yes, and here's why. Connective tissue disorders, even things like Ehlers-Danlos syndrome, often present with chronic pain due to joint instability, hypermobility, and tissue fragility. And here again, because histamine is an inflammatory molecule, if someone has histamine intolerance or MCAS, mast cell activation syndrome, and there are things that are preventing histamine from being broken down, that excess inflammation can worsen the fragile state of that connective tissue. And that can, of course, leads to increased pain and dysfunction in the tendons, in the muscles, in the ligaments. And it's definitely, in my opinion, an area that's worth exploring when you're living day in and day out with this chronic pain. So what do we do about all this, right? If you suffer with chronic joint pain, fibromyalgia, or a connective tissue disorder, where we know that chronic ongoing inflammation is a root cause, there's a few things that we need to know, right? First, we need to know, number one, what's causing your mast cells or your eosinophils to discharge or release all this histamine and these other inflammatory chemicals. In other words, what's triggering all this extra histamine in your body? And number two, why can't your body break it down efficiently? Now, as far as question number one, what's causing all this extra histamine, there really could be many different causes. And if you're not familiar with the histamine bucket analogy or the histamine bucket metaphor, it goes like this. If you imagine your body as a bucket that collects histamine from just many, many different sources. Could be food, could be stress, could be environmental allergens, could be bacterial, could be hormones, and even from the natural metabolic process happening within our body. Normally, your body efficiently processes and eliminates excess histamine to prevent it from overflowing. And it does this with built-in enzymes like DAO and HNMT. These enzymes work by breaking down histamine when the levels get too high. But when too much histamine accumulates for whatever reason, maybe it's an overconsumption of histamine-rich foods, maybe it's a food allergy or some kind of environmental allergen like mold or dust, maybe it's some kind of problem in the gut microbiome, maybe you have too many histamine-producing bacteria, not enough histamine-degrading bacteria. I think you get the idea. Whatever that reason might be, your bucket just begins to overflow. And in this case, your chronic pain begins to flare up. Now, like I said, with problem number two, this also needs to be addressed, and that is why your body can't break down the excess histamine. So with this problem, the question now becomes, what's impacting the enzyme? Does a person have a chronic inflammatory disorder in the gut, like small intestinal bacterial overgrowth? Do they have celiac disease? Do they have Crohn's disease or ulcerative colitis? Has there been damage to the gut? Basically the enzymes that are produced by the cells in the gut that make DAO? Has there been damage to the kidneys? Maybe it's genetics. But all of these scenarios can impact the way your DAO enzyme begins to work. But here's the good news. Good news is that studies show that taking this enzyme, DAO, does a great job at reducing histamine levels. So if you can address these two major problems or these two questions when it comes to histamine intolerance, like I said, number one, what's causing all this extra histamine? And number two, why your body can't break the excess histamine down, you'll be able to get this histamine inflammation under control. Now, I want you to keep in mind that when it comes to treating histamine, there is no one thing that's going to get rid of all the histamine in your body, right? This is a multifactorial condition. There's a lot of different causes behind it. And I've worked with lots of patients over the years, and the one thing that I will tell you is that people that have histamine intolerance or MCAS, they have it for different reasons. But to sum it all up, here's what I would say. Number one is addressing histamine intolerance involves dietary adjustments, it involves lifestyle changes, it involves supplements, and in some cases, yes, it even involves taking certain medications. But the goal of treatment really should be aimed at reducing histamine levels by reducing those things that are filling up your histamine bucket. Now, while I've tried my best to simplify the relationship between histamine intolerance and conditions like joint pain and fibromyalgia and RA and connective tissue diseases, understand that pain is complex, but understanding the role of histamine can offer new approaches for pain relief that have previously been overlooked. Now, if you suspect that you have histamine intolerance that's contributing to your joint pain, your fibromyalgia, your connective tissue disorder, visit my website and take the Histamine Intolerance MCAS Quiz to see if this is one of the potential root causes that's contributing to your joint pain. Well, that's going to wrap up today's video. If you liked today's video and you found valuable information in the content, I want to encourage you to watch some of the other videos on this channel. but also to be sure to check out the 900 plus health articles on my website. Till next time, take care.